We're live.
Live. Good afternoon for some and good evening for others. This is Jaran Mohammed. I'm a journalist. I do a weekly column in the Final Call News, which is Chicago-based and published by the Honorable Minister Louis Farrakhan. We're here to talk about a forum that will take place on April the 9th. Thursday, April the 16th, rather. Today is the 9th at 1 p.m. Eastern Standard Time. And the forum will be called The Economic Ramification of the Africa, the Economic Ramifications of the Coronavirus Pandemic. Trade disruptions are drying up oil and tourism industries, debt vulnerabilities, and a limited scope for monetary policy maneuvers threaten a slew of African economies as the coronavirus pandemic arrives on the continent. So in that context, we'll be dealing with the issue of how economics in this environment, in the coronavirus environment, is impacting on Africa. And I have two other guests with me to speak about this issue today, but I'm gonna mention all of the panelists that will participate in next Thursday's event, which includes Mekki El Mughrabi. Did I pronounce his name right?
Mughrabi, yeah. Mughrabi,
okay,
yeah.
He's a press writer on economy, development, and stability in Africa, and he's also the president of Mekki Center for Media Studies, and he's based in Sudan. Also, we have Naba Mohammed, the editor-in-chief of the Final Call News, which is based in Chicago, as one of the narrators. We have, in addition, Crystal Simoni. Did I say that right, Ndongo?
Yeah, Crystal.
Okay, is currently the economic justice lead for Femnet, one of Africa's largest women's rights networks, where she leads a body of work that intersects Pan-African feminist narratives into macroeconomic policy processes and spaces on different levels. In addition, we have Riaz K. Tayeb. Did I pronounce that right?
Tayeb,
yeah. People's names up. He's a researcher at the Southern and East African Institute, the South Africa chapter. Also, Reg Nkosi, Executive Director of First Source Money and Public Banking. I think that's it, besides the two guests that are online with me today, and they can introduce themselves, starting with Dr. Sila.
Hi, Jerome. So I am Nambo Samba Sila. I am a Senegalese development economist. I am based in Dakar, where I work for the German foundation, the Rosa Luxemburg Foundation.
And I am over here in Istanbul. My name is Khalil Charles. I'm a journalist, as a journalist here. Yeah, I was just introducing myself. I'm Khalil Charles. I'm a journalist here in Istanbul. I've been here for 4 years working for TRT World, which is a 24-hour news service in Turkey. And my job has been, when internet is unstable, my job has been to really to coordinate a lot of what's going to go on, helping with the moderation, as well as, my writings are basically based around the things in Africa, in particular in the Sudan, which I spent 13 or 14 years in the Sudan.
Okay. Well, I'm going to open the discussion up between the three of us. Now, this kind of came out of me writing about, in my column, which appears weekly in the Final Call, called Africa Watch. My last four columns, the latest came out today on oil, the impact that the oil industry or coronavirus is having on the oil industry. So, and this, with my relationship with Dr. Sila, grew out of that, where we said, well, let's have a global discussion and involve other economists and journalists to discuss globally what's happening around coronavirus, especially as it impacts Africa. Now, there's an interesting piece in today's CNBC, and I'll read part of it and then open the discussion up between the three of us. The African Union has projected a contraction across the continent. Of course, that means Africa economies, and the loss of almost 20 million this year this is 20 million jobs amid the fallout from the coronavirus pandemic. A report from the Continental Union, that's the African Union, which comprises 55 African nations, cautioned that both formal jobs and informal jobs will be at risk. The informal economy, any economic activity that falls outside the regulated economy and tax system, such as street vending, constitutes a significant majority of employment across the continent. Africa still accounts for a small percentage of confirmed coronavirus cases worldwide, the entire continent having now confirmed 10,663 cases as of Wednesday morning, against a global tally of more than 1.4 million. By contrast, the US, which has confirmed more than 400,000 cases, is expected to see the total employment reduction of up to 47 million in a worst case scenario, according to the Federal Reserve. So can we talk about what that means for Africa? Starting with you, Khalil.
Well, indeed, the pressure it's going to put on both of the economies, the formal economy and the informal economy, is going to be absolutely huge. One can assess perhaps that the numbers, the relatively low numbers that we have at the moment with the disease, that the curve will not probably see this kind of thing we're seeing in Asia and we're seeing in Europe with regard to the pandemic itself. We know that there's been the UNESCO have supported the idea of pumping money into Africa to help the resources in those countries. However, the dependency on most of the economies, are likely to be dependent on the foreign trade and the investment that they continue to get from the outside. And I think one of the persons who will be able to talk more about that is Dr. Jango in Senegal. In your capacity, Doctor, what's your assessment, given that in where you live in Senegal, there's a high percentage of the informal market operating in your country?
Yeah, this sanitary shock will have at least short-term effects on our economies, which are dominated, as you said, by the informal sector. In many African countries, the informal sector represents at least 70% of non-agricultural employment. So it's huge, even in the capital cities, you see. So it's going to be really difficult because the formal sector will see its size diminish, less income, less activities, and to some extent, the money that the informal sector, let's say workers in the trade sector are able to capture, depend on the demand they could receive from the formal sector, you see. So it's an interlinked situation. So it will be very tough. And at the same time, we know that the more this sanitary crisis lasts, the more it will be challenging for our governments to tackle the economic, let's say, effects of this sanitary crisis. So we expect that this will be a short-term shock for many African countries, so that we'll have more room for maneuver for African countries. Because for now, yes, we need some help from abroad.
Can both of you mention what you'll be adding to the conversation next Thursday, and what you plan or want to come out of the conversation with? I think, Sila, you sent me a kind of an outline of the issues that you think that should be discussed and what kind of outcomes the discussion will produce. And if you can do the same, Khalil. Go ahead, starting with you, Dr. Sila.
Yeah, it will be important to have a kind of state of play regarding which countries are affected and what will be the tendency, because we know that the economic effects will depend on how long the sanitary crisis will be, you see. And at the same time, we know that there have been some proposals, let's say, from multilateral institutions and from countries from the global north to help Africa. To what extent those kind of, let's say, proposals help African countries deal with the situation or not, we'll have to discuss about that. Another interesting topic is that we are living in a period where many myths, many myths are being exposed, you know. So, for example, the myth of free trade. For example, the myth that governments issuing their currency could lack money, you know. The myth that countries could go into international markets and borrow money as they would like, you see. So there are many myths being exposed. And so one practical issue is what we have to do as intellectual to face this crisis, which an intellectual opportunity to defend as a set of, let's say, public policies, which would be more beneficial to African populations. So this will feature also in the discussions we'll have next week.
And same question, Khalil?
Yeah, sure. I think really we're looking for awareness both within Africa and as well as outside of Africa in terms of its needs at this very crucial point in history. We know that Africa, in terms of its expansions of its economy, has been making progress over the last 10 to 15 years. So this is likely to put some problems in the way. But I think, you know, as somebody from the media, our job is to make sure that the awareness of what the coronavirus can do, as well as the solutions to some of that, is important that we discuss some of those solutions in the process of this online meeting. And I also think that it's also a chance that one has to think about the opportunities that might be available for African entrepreneurs, for people who can fill the gaps that are now being lost in some respect by the markets that are affected in Europe and the other parts of the world. And so we have to find ways of benefiting Africans in this forthcoming period, because there will be substantial changes in the money flow, substantial changes in the direction of business in the forthcoming months. And I think we should think about what the ways in which they can capitalize on that. And basically to be very much in keeping in mind that the African stories, I mean, I'm a journalist, and those are the ones that we should be looking at and talking about, so we don't get left out in terms of the assessment of how this has affected the world. I don't want it to be an assumption that, oh, because we're in Africa, it doesn't really matter. And of course, you saw this ridiculous statement, which is condemned in uncertain terms today by the head of the WHO, who said, condemned a person who came out, the French official who came out and said that they should test for a vaccine by going somewhere in Africa and test it on the Africans.
Right.
You know,
right. That was a French doctor,
this
right?
is the kind of in nonsense that we need to make sure that there's a firm rejection of talk like that, and that nothing of that nature can take hold on the African people who suffered enough at the time when Ebola was ISIS. People weren't taking it seriously in the rest of the part of the world. So we don't want to be left out at all in that. I think there's some of the important things that we should be discussing and moving towards.
Now, since you're a journalist, Khalil, you know, and in recent several pieces I've read discuss the disinformation that's going around the continent concerning coronavirus. So it seems that there's a need for some kind of rapid response mechanism to be in place to respond to all this misinformation that's going around. Because this is kind of, and I'm taking kind of my lead from Trump with all the disinformation that he's spewing around the world that's actually causing people to die. So that kind of information being spewed into the consciousness of Africans, you know, will have the same kind of effect, you know, on people's lives and people losing their lives. Respond.
Yeah, I absolutely agree with you. I think one of the key things that came out very early on, there was a story of a Cameroonian who had in fact been told by Chinese doctors that because he was African, he was less susceptible to catching the coronavirus. And of course, that's gone round for some of our communities, believing that Africans and of African descent in the diaspora are not likely to face the problems in this area. That's completely false, because when you look at what's happening now in New York, in the major cities of America, where you see there's a disproportionate proportion of African Americans dying. 70% of people, I think, in Minnesota or Milwaukee, whatever. I didn't think, but the important thing here is that misinformation has to be countered very, very quickly. There's also this question of the 5G, how that affects it. Now, I looked at that as well. There doesn't seem to be any basis behind that at the moment. But so there are a plethora of stories. As journalists, it's our job to fact check that and give the reality as it stands on the ground, and also to bring that awareness. Because I think Meki, who we our guest from Sudan, can tell you that there's a growing awareness now in Sudan. They've only had 19 cases and 2 people dead, but there's a growing awareness that they have to do something about that in order not to allow that situation to spread. Given the fact that Africans are evolving formal economies and need to go out to work, of course, and the shutdown situation can't be put into effect in the same way as the rest of the European countries. But nevertheless, curfews and stopping people coming out in different times of the day can be more effective. And because woe betide if it takes hold as a medical problem in Africa. Many African countries simply don't have the economic health structure to be able to deal with this catastrophe. So that's the awareness that we have to continue to pump in order to avoid the problems that are likely to.
Now I have, thanks, Khalil. I have 2 questions for Dr. Sylla. One having to do with recently I read several reports where when virus hit Africa, many of people that were living in these real densely populated urban areas, in these big cities, they got up and said, I'm going back to my village, to the farm that I grew up on. And according to several pieces I read, there was this kind of mad exodus going back to these villages. I want to know what the economic ramifications of that is, and the fact that maybe some of these that are going back to these villages are taking coronavirus with them. And after you respond to that, I have one more question for you, Dr. Sylla, and Charles or Khalil, you can respond as well. Go ahead.
Yeah, I don't have a picture of the situation for the whole African countries, but if I can take the case of Senegal, for example, Dakar is our capital, and it's very dense. You see, Dakar is 0.2% of the whole area of Senegal, you see, but it's more or less 1/4 of the whole population. So the average density of Dakar is 83 times the density of the rest of Senegal, you see.
What's the total population of the country?
We are 16 million.
16
million people.
And what's the population in
1/4 in
Dakar?
Yeah, more or less 4 million, you see. So that means that in some neighborhoods, it's really densely populated. And the fear of the authorities were that if some of, let's say, the people who are infected go back to their villages, this could, let's say, spread the viruses in the real areas.
Right.
And we know that in rural areas, it's too complicated because we don't have the right health facilities, and most people don't have access to water or to soap. So the strategy is to say that we have to maintain people in the cities. That's why they stopped, or let's say, transportation between regions, you see. But at the same time, it's tough for some workers. If you take the case of the people of the informal sector working in households, performing domestic chores, you see. Now many households fear that their employees could have the virus, you see, because those people generally they live in very densely populated neighborhoods. Sometimes in one room you could have 5 or 6 women working on, living in that kind of conditions. And now many urban households, they fear that they could get infected through their domestic they employees, And many of them, as they no longer have access to job, no longer have access to income, they could no longer pay their rent. So what they can do, they are going to their villages. And this could be a danger, which could spread the virus in real area for which the government has no control at all.
Now, the other question had to do with economics of the fact that the Prime Minister of Ethiopia had asked money from, I guess, from G20. I think he asked for about 120 billion, I think, to help with the to mitigate the coronavirus. I read where a group of health ministers had asked, I don't know if it was the World Bank or the IMF or, some outside entity for 100 billion to help mitigate coronavirus in Africa. But what's Africa doing for itself, to curb this pandemic?
Yeah, most countries, in most African countries, the central banks have taken some measures, cut interest rate a little bit. They are committed to provide liquidity to the banking sector and to facilitate the fact that some businesses will not be able to pay their debt they owe to their bank. So some measures have been taken along that lines. But those measures are not sufficient because we know that monetary policy is a very slow tool and it's not a direct tool. So some governments have, let's say, designed a fiscal package in order to target those who are most likely to be affected by the economic ramifications of the coronavirus, the informal sector. And in many countries, there are, let's say, programs aiming at facilitating the access to food for the most vulnerable households. You can find things like that. You can find also kind of support for some businesses and also subsidies to some basic consumption items of a household. You can find that. But we need also to import things. And when you need to import, you have to have access to foreign currency and help expected from the multilateral institutions and also from the G20 countries, let's say financial, support for the kind of spending abroad, you see, to acquire, let's say, medical equipments, medical material, and things like that. But yeah, for now, we know that most African countries have very limited, let's say, fiscal room for maneuver because, yeah, most of them lack monetary sovereignty. And I think that Reg and Nkosi, who is an expert in central banking issues, in banking issues, money issues, yeah, I think he will give us a very...
The head of CDC for African Union, right?
Yeah, he's from the first source money. He will be our panelist.
Okay.
He will be there next week, yeah, to talk about the South African case and what has been done. It will be interesting to hear from him and also to hear from Riaz Tayyip, who has a different idea about, what Pan-Africanism should be in these current circumstances. And our sister Crystal Simeoni will likely to talk about the gender aspect of this crisis, because we have to remind that women comprise the major share of the informal sector. And if women do not work, it will be tough for many households.
Khalil, you want to jump in?
Yeah, sure. I mean, in general, there are, like Doctor said, it's difficult to get fiscal measures to have an immediate impact. So we've got some countries that are trying to stabilize their currencies now, trying to not just the CFA, but you also find in East Africa as well, with Ethiopia and Sudan and also Eritrea, trying to put some money back to try and stabilize their currencies, which has taken a real hit, not just since Corona, but sometimes before that. Direct support for the needy and setting up a national fund, a national charitable fund, is some of the ideas that have been put forward on the continent. And some of the, are asking for charity at home, as it were, as well as getting the percentage of monies coming from the expatriates to go into a general fund to help those who need it most during this crisis. I know the situation, obviously, in places like Sudan, which I have a lot of experience of, the fuel and bread shortages that are carrying on here. There's no idea of lifting the subsidies now. They're going to have to continue the subsidies because of Corona. The thought was to gradually reduce the subsidies in accordance with the demands of the IMF, but it looks like they're going to continue that for some time to come. And it also looks like they're going to default on some of the payments, because there's simply not going to be an ability to pay what they owe in terms of the debts, as well as upkeep of the economy, and so the plea, if you like.
Let me stop you for a minute, Khalil. Because there was a piece that I read recently. The African Union world leaders had met, and they're asking for the debt to be curtailed totally. Go ahead.
Yeah, indeed, that's the case. I do recall that, and that's really. Well, I don't know how effective and for how long they're going to be able to do that, is to hold off on some of these debts. But it stands to reason that if you're getting debt windows for citizens in different countries, then at the very least, something of that nature can be extended to the African continent. Given that, it's not. I don't imagine they'll wipe off the debt altogether, but that would be nice if they did that. But in these trying times, you're going to see Africans having to try to pull together. You have the IGAD, which is in East Africa, the development agency in governmental agency in East Africa, which covers from Djibouti to Ethiopia to etc. Those areas. That whole area is looking at creating a fund for Corona to help manage the crisis, as well as get some expertise from outside that they can share between the countries. So there is talk about regional support in doing more for themselves. But likewise, like the doctor said, it's very limited what they can do. It's very limited in terms of their finances, what they can do for the ordinary citizen who's likely to be affected, whether economically or whether medically, by this problem.
Same question, Dr. Sealer, and then can I get closing statements from both of you, and then I'll wrap up. About the debt that the world leaders, African leaders, had asked their countries to be forgiven.
Yeah, the president of my country, Macky Sall, I think he was among the first to say that the African external debt have to be cancelled. He's one of his propositions. Before that, the IMF and the World Bank, they called themselves to the multilateral lenders, saying that we have to give a moratorium on African external debt. I think this is a sensible proposal because we know that most African countries are spending more on paying debt interest than, let's say, investing on the health sector, you see. So we could not afford to pay debt interest at this precise hour, you see. So there's this proposal. But you have to know that, let's say, for the last 10 years, African external debt structure has changed somehow. Before, the type of debt we have, it was concessional debt. That means debt given at conditions, let's say, preferable more or less to market conditions. Debt with longer maturities and, let's say, lower interest rates. But now, countries like Senegal, Kenya, Nigeria, Morocco, they have issued Eurobonds. That means they have issued debt to private creditors. And those private creditors, they will not, let's say, accept the principle of the African debt to be canceled. No, they will resist. So at the same time, we see that within African countries, there is no unity because Nigeria said, yeah, I will pay the debt because the external debt of Nigeria is relatively small compared to the other countries. South Africa said we do not need the IMF and the World Bank. That's what they said for now. But those are big countries. What are we going to do with the countries like Zambia, who are in a debt distress? So we need African strategies to address that. And I think the idea of canceling the debt, even private debt, we have to fight for that. But at the same time, this will not be enough. Why? Because debt is a symptom of all our, let's say, dependencies, trade dependencies, financial dependency, etc. So we have, in the same time, to tackle all those issues, to profit from this context, to try to have alternative ways, let's say, of managing African development with more financial and, let's say, trade self-sufficiency.
Thank you. So we're going to wrap up a closing statement from Khalil and then Dr. Sylla.
I think what we're doing here is quite unique. We are giving African solution to African problems, and we also putting it out so there can be some understanding of the way forward. So I'm pleased to be part of this project. I'm pleased and great if we can have some follow-ups. I'm already looking forward to the follow-ups that we should do in terms of.
And we ain't had that real problem.
I know. I'm really looking forward to that because it sounds like an exciting time to be talking about these issues and trying to find some solutions, putting them down on the tables for discussion. So, you know, and perhaps we get more and more people qualified like a doctor to address those queries from alhamdulillah, address it from their expertise and their knowledge of the African continent, and you know, anything we can do as media journalists to put across that message and get it succinct in a succinct way, then we're glad to help about that. So that's really where I see this going, which is great.
Alhamdulillah, great. Dr. Sylla, final statement.
Yeah, I could only say I am really happy that we'll have an extended conversation on the economic ramifications of the coronavirus in Africa next week. I am thanking Final Call and you, Jeroen, for organizing such a conversation and connecting
the big bucks.
Yeah, you see, connecting the continent and the American diaspora. That's really fantastic. We have to have an African perspective on the current African issues. And I'm thankful for that. I'm really happy to know also Halil Charles, and yeah, looking forward to nice discussions with both of you and other panelists.
Great. Yeah, well, this was a inspiring session. I mean, this is just a taste of what whoever the listeners are that are online now will be getting next Thursday at 1 p.m. Eastern Standard Time. Stay tuned. Now, there's some things that we'll do in the process of working our way to next Thursday. We have to hashtags. We'll post those hashtags. Anybody that wants to get in touch with us can email me at aroundthenation@icloud.com. Again, aroundthenation, one word, @icloud.com. If you have any questions or you want to participate in some way, we really would appreciate. Also, what we're doing, some of my professor friends and some friends from high schools, all their students are home. So we're trying to create a kind of social media army of students who will be viewing next Friday's program and in real time send that information out, utilizing the hashtags that we'll be providing them with. So they'll actually in real time be sending this information out around the world. So stay tuned for that. Email me if you have any questions or any insights. If you want to participate, this hopefully, inshallah, will be the first of many forums dealing with these pertinent issues that affect Africa. I mean, we want to unite the African diaspora. I mean, we should be one. I grew up under Muhammad Speak newspaper from the 60s and the 70s. And on the cover, the masthead were two black hands clasped together across the ocean, the Atlantic Ocean. We're trying to do that again, reclasp those hands and show unity among our people. So unless you guys have anything more to say, we're looking forward to you guys getting on board next week and taking this discussion to the next level. Thank you.
Thank you, Jerome. Thank you very much.
Also a shout out to Brother Troy, who's the behind the scenes engineer of all of this. Hi.
Right.
How do y'all think it went?
Yeah, it's great. Great. I love it. I gotta go now. I gotta make Salah and stuff like that. Look forward to it, man. I look forward to it, man.
Brothers.
Thanks, Brother Troy. Thanks, Doctor. Take care.
All right.
Thank you, both of you. Take care. Keep safe.
Okay.
All right. I thought it went well. What do you think, Sila?
Wonderful. I could only congratulate for this. I think how